Increasing pain and a lack of function are the two biggest reasons that you may need to consider having a knee replacement. Some patients will be able to manage quite well with pain relief, physiotherapy, and natural supplements. The GLAD program, for example, is a specific physiotherapy program for patients with hip and knee arthritis symptoms. It aims to help patients reduce their pain and increase strength and mobility. It's really worthwhile speaking to your physiotherapist about this some more. The decision about when is the right time for a knee replacement is a complex and personal one. However, I would strongly encourage you to make a decision based largely on your level of pain and loss of function. Or, put simply, how badly is this troublesome knee affecting your quality of life? You simply do not need to have a knee replacement just because an X-ray or MRI scan shows that you have arthritis. In fact, many patients have arthritis, but their symptoms are quite mild. There is also no rush to have a knee replacement. You have plenty of time to think about your options and try other treatments. However, over time, arthritis symptoms do worsen as your joint continues to wear out. We can't permanently cure arthritis without a joint replacement procedure. Getting a broad range of opinions from healthcare professionals is also very helpful. Your general practitioner and physiotherapist are great sounding boards. They are people you know and trust, and they also know you and your health history. In my experience, most patients have told me that eventually they reached a point in their life where they just knew it was the right time for them to have a knee replacement. Ultimately, this is a very personal decision for you to make. So thanks for sticking with me through what I know was quite a long and information-heavy video. But I hope that this has given you a comprehensive understanding about knee replacement surgery and that it helps you in your decision making. If you would like to talk to me about your knee, then please call my rooms at any time. If you haven't already had appropriate scans, I can easily arrange for these to occur before your appointment.